here at 8 o'clock. Thank you very much. In the name of St. Gallen Oncology Conferences, and of course of my co-chair Manfred Lutz, I would like to welcome you to the third St. Gallen Gastrointestinal Cancer Conference. I think we have 2.5 very interesting days ahead of us, but as has become a tradition, before we start the scientific program, I would say a few words and give you some piece of information about St. Gallen. So if you come to these conferences often, time after time you get one more piece of information and you know all about St. Gallen. So we're here at the OLMA fairgrounds, and maybe you have been wondering what OLMA stands for. So it's obviously an acronym, and it takes some explaining to tell you what it means. We have to go back a little in time. So 250 million years ago, St. Gallen would have looked like this. So there was a sea where we are now, and over millions of years, the sediments would fall to the bottom of the sea and form layers of sediment that then compacted due to the pressure of the water and become limestone. Eventually, Africa, the African tectonic plate, would separate from South America and move towards Europe. So, of course, you wonder where's the OLMA now? It's like right here. Due to the pressure from the African and the European tectonic plates, the seafloor would rise, slowly but steadily, and soon the first beginnings of the Alps would appear above the water level. And as soon as the rocks stuck up out of the water, erosion would begin. Now, the erosion started to take gravel from what was beginning to be the Alps towards the north and the south of the Alps, and large rivers would form and take the gravel to where we are now, basically. Now, again, this gravel would build up, mixed with sand, and compact, and form something that is known as molasses, or we locally call it Nagelfluh. If you want to see Nagelfluh for yourself, you can take a short stroll behind the cathedral in St. Gallen, in this gully called Schlucht, and you can see Nagelfluh for yourself. Now again, the pressure would increase, the African plate would come closer, and the limestone layers would fold up. And this picture is taken like 10 kilometers to the south of where we are now. Those of you who like the outdoors will notice that this is ideal climbing ground. But at the place we are now, the Nagelfluh would break up in large chunks, and these would form hills. Now, as you may be able to tell from this picture, it's difficult to make a living in this area because you have no farmland. All you can do is raise animals. So people started raising cows and cattle and sheep and goats. And since people are competitive, farmers started to compare their animals, they started to compare their kinds of cheeses. And so it's quite logical that at some point of time, that was in 1943, they started to have an exhibition here in St. Gallen, where they brought their cattle, where they brought their cheese, and exhibited their produce, and it is called Eastern Switzerland Agricultural and Dairying Exhibition. If you translate this into German, it's Ostschweizer Land- und milchwirtschaftliche Ausstellung. So this is where OLMA comes from. Now the OLMA still exists today, and every year in October, for a 10-day period, we have this exhibition here, and it attracts nearly 500,000 people. In this hall, you would have basically the cheese exhibition. In the hall on this side, you would have cows, you would have sheep, you would have goats, and in the halls on the other side, they are the most interesting. You have the wine tasting. Every day when this OLMA exhibition is on, there is a special event. Maybe you've noticed between this hall and the one next to it, there is an arena. It looks like this. At a certain time of the day during the OLMA, people would gather around this arena to watch a certain race. Now this race needs a lot of preparation. The competitors in the race are being trained for days and days and do hard work and practice. But they are not horses, they are not dogs, or whatever you may have seen in your life racing. This is what the race looks like. And there are actually betting shops, so you can bet your money on certain piglets. So with this piece of information, I leave you, and with this impression of St. Gallen within the Nagelfluh Hills. Thank you very much. I hope you enjoy the meeting. And now, Manfred, I'd like to ask you to tell us a little bit about the concept of the meeting.
Yeah, thank you, Florian. It's difficult to get the relation between piglets and pancreas, but somehow I think there is something there which we use every day. But on the other hand, I think we have a good conference, and the history is also not quite as long as the OLMA or St. Gallen, but it's the third time that we meet here in St. Gallen, which is a great pleasure. And as you may have noticed, the first conference was on gastric cancer, then we had a conference focused on rectal cancer, and now we thought that the next step is a closed sort of organ which we can treat very well in a 2.5 day conference is pancreatic cancer with a little bit around it. The background of the conference is that St. Gallen has a tradition of organizing the breast cancer conference, which is a conference focused on the primary curative treatment of breast cancer. And similar to that, in the alternating years, it takes place every 2 years, we thought it might be useful to do a GI conference in the same setting. So the focus on the conference is entirely on curative treatment or potentially curative treatment of a given cancer. And this is usually done with multiple modal approaches. So we are not a pure oncology conference, but we try to unite basic researchers, surgeons, radiotherapists, oncologists, gastroenterologists, so to kind of get them to talk together about the topic. And to do that, there is 2 days of presentations, and on Saturday, sort of a revision of what we heard, and the discussion of those who presented on topics which might be interesting to translate and where we don't have enough evidence for the moment. So that's the setting of this year's conference. You see that from the program. And what's important to mention is that the Saturday session, and that's the focus of the conference, it's not a guideline session. So we don't need to agree in the end on something which has to be done, and it's not necessary to have 100% vote on something, but it's more that we want to have an exchange on topics which are a little bit controversial, where maybe someone has a different opinion than another one, where we don't have too much evidence, where we are based on experts which tell us or who advise what they would do in their home hospital. And to get that a little bit more sort of coordinated and stimulating, we take again the concept of the breast cancer conference and circulate before the Saturday meeting a set of questions. This time it's 69, so it will be less at the end because we end up with 40, 50, which can be usually well treated within this session. So we end up with a set of questions which is circulated before to those who are on the panel. They can give their input and suggest what might be more interesting to ask than other things. And then we start with a vote, which often is, say, 70-30 or 50-50, and it needs to be explained. And that's what we are here for. We vote, and then we have an expert panel on commenting on the vote, and maybe sometimes, if someone is very convincing, we vote again and come to a different opinion. The planning group is given here, but that's also in the program. And the topics for this year's Saturday session, it has the evidence from the few last years has shown that it's not good to have too many different topics because we need to go in depth a little bit, is that we would like to discuss with you the preoperative staging. For example, is CT scan necessary, or is a chest X-ray enough if we have an operable pancreatic cancer? Do we need to do all that? What do we do with small nodules, things like that, which is interesting to know, but we don't really have the evidence. And the big chunk will be the approach to a borderline resectable cancer, because that's sort of the big thing right now, right? You have operable, you have inoperable, you have something in between, and it's, for me at least, not quite clear why this is in between. It could be for an oncological reason, that patients do well and need more therapy because surgery alone is not enough, or it could be a technical reason that it's simply not easy to resect, so the operative mortality is high, and it's not really oncological, but it's technical. So these are things which we would like to address with you, and in the end then we have the adjuvant therapy and a little bit of locally advanced pancreatic cancer. And to follow that up after the conference, it's a tradition that the presentations are summarized in a booklet, which is published quite soon. And we also try to summarize the discussion. The contents of the discussion is a manuscript, which is usually published in the European Journal. Out is the first one, and the last one is still in the review process, so, but I'm sure that it will come out quite soon. And if you want to listen to the presentations, I think you will see this slide again often during the conference. You can log into Oncoletter's CH and have a look on each of the presentations so that you can review what has been discussed. So before we come to the first session, the conference also is not set up quite usual that you have one presentation and a discussion right afterwards, because we thought that also for the Saturday, it's interesting sometimes to kind of have 3 presentations in one session, kind of approach one topic from 3 different angles, and then already start a discussion between the presenters in depth, so that we can approach already a little bit the Saturday and point to the questions which might be interesting to be answered by the experts at the end of the meeting. So don't wonder. We have 3 short presentations, and then we try to have 20 to 30 minutes of discussions within each session. And having said that, I would